This presentation explores whether Canadians truly receive enough public service value to offset slightly higher taxes compared to the United States. In the following slides, we unpack the tax burden, evaluate the structure of Canada's public services, compare economic outcomes across both countries, and determine the overall truthfulness of the claim. By the end, we will see how universal healthcare, predictable public benefits, and reduced catastrophic financial risks shape middle-class prosperity in Canada. The answer is that this statement is generally true for typical middle-class Canadians. While taxes may be marginally higher than those paid by similar earners in the United States, the value Canadians receive through public services, especially in healthcare, income supports, and education, often results in stronger financial security and better long-term economic stability. These benefits do not apply equally to every individual, but on average, a Canadian middle-class household experiences more predictable expenses, fewer financial shocks, and greater resilience than its American counterpart. Canada's tax system creates a total tax wedge of about 31.9% for average workers. This tax wedge represents the gap between what employers pay in labor costs and what workers take home after income taxes and payroll contributions at both the federal and provincial levels. However, Canadians face very low out-of-pocket medical costs, meaning that although the tax wedge is higher, household financial risk is significantly lower. In the United States, the tax wedge is slightly lower at roughly 29.9%, but this number excludes the large private insurance premiums, deductibles, and copays that middle-class families must routinely cover themselves. As a result, headline tax rates can be misleading. They often hide the much larger differences in real, unavoidable household spending between the two countries. A rough estimate based on known data. A typical U.S. middle-class family with average employer insurance premiums plus deductibles plus copayments would be adding perhaps 5 to 10 percentage points, or more, to the 29.9% and could push the effective tax plus health cost wedge to 35–40% of labor cost. That would exceed Canada's 31.9%. But this is an estimate only, not a verified figure. Canada's universal healthcare system eliminates deductibles, copays, and insurance premiums for medically necessary care, protecting families from catastrophic expenses and unpredictable financial shocks. Education costs, including post-secondary tuition, are significantly lower than in the United States, and federal and provincial grant programs help reduce the cost burden even further. Income supports such as the Canada Pension Plan, Old Age Security, and child benefits deliver predictable long-term security and reduce the effective tax burden for families. Canadians benefit from a public service environment that fosters stability, affordability, and long-term well-being. When factoring in essential costs, Canadian disposable income often matches or surpasses that of similar U.S. households because Canadians avoid large private healthcare expenses. Medical costs are a leading cause of bankruptcy in the United States, whereas such occurrences are extremely rare in Canada. This allows Canadians to preserve long-term savings, retirement funds, and home equity far more effectively. Canada also enjoys higher life expectancy and better outcomes on preventable mortality, which strengthens productivity and overall social welfare. These factors contribute to wealth protection and more stable household balance sheets across the middle-income population. There are circumstances where the U.S. may yield better outcomes. High-income households with premium employer-provided insurance can experience excellent coverage with lower taxes. Middle-class families living in very low-tax states such as Texas or Florida may also face a lower tax bill, though they must self-fund many services. In regions where insurance markets are competitive and employers offer high-value benefits, some households may fare as well as Canadians. However, these cases are exceptions rather than the norm, and many Americans still face substantial healthcare-related financial risk. Overall, Canadians do pay slightly more in taxes, but they receive more comprehensive and predictable public service value in return. The typical Canadian middle-class household benefits from greater financial certainty, reduced exposure to catastrophic expenses, and more stable long-term economic outcomes. This makes the statement true for the majority of middle-income families, though individual circumstances vary. In conclusion, while middle-class Canadians face a somewhat higher tax burden, they benefit from universal healthcare, lower financial risk, and a resilient social safety net. These advantages translate into stronger long-term well-being compared to the U.S. middle class. Canada's model is built on stability, affordability, and predictable public spending, producing favorable overall economic outcomes for most middle-income Canadians. The Canadian Institute for Health Information contributed data on healthcare funding structures and the comparative affordability of Canada's public model. The Commonwealth Fund provided cross-national comparisons of healthcare spending and health outcomes. The American Journal of Public Health supplied evidence on medical bankruptcy and financial risk in the United States. The OECD's taxing wages and revenue statistics datasets provided cross-country tax wedge and tax-to-GDP comparisons. Statistics Canada supplied Canadian household income and well-being indicators. The Conference Board of Canada contributed comparative health system performance metrics. Viewers can pause here to view the full citations and follow links to the source material. For more fact-based content about Canadian politics, democratic health, economic trends, and rhetorical analysis, the Facts for Canadians platforms offer ongoing resources and educational material. These outlets aim to strengthen public understanding, improve media literacy, and support evidence-based democratic engagement.